Dr. Daniel here. Let's talk about eye drops. We'll go through several topics. First, how to administer the drops properly. And let me say this for glaucoma patients and those using eye drops for long periods of time chronically, it is hard. And so, have a system where you remember to use the drops, lock it in when you brush your teeth, for example, or a funny alarm on your phone that goes off at a certain time of day, but get a system to remember the drops. It's hard enough to do the drops. The important thing is just getting the drop in the eye so that the eye gets wet. And as long as you feel the eye drop touching the eyelashes where it gets kind of pulled into the surface of the eye, then the medication's getting in there. If you're having trouble getting the drop in your eye, either because you've got a strong guarding reflex and you squeeze really hard, or you've got some mobility issues or arthritis trouble, one thing you can try is taking the eye drop bottle and laying flat and put the edge of the bottle on the bridge of your nose and just drop that medication just right there in the corner of your eye, and it will roll right down into your eyelids if you're laying flat. So that's a great trick if you're struggling. For those who want to give the drug the best chance of working, some providers feel strongly that you should close your eyes for about a minute and put some pressure right where your eyelids come together, slightly on the lower side where it goes towards your nose. That dramatically lessens medication going into your nose, which is why you can taste it sometimes, and keeps the drug on the eye longer. I don't feel strongly about this. I think getting the drops in the eye is the most important part, acknowledging what I said before about how it's challenging to use these chronically in the first place, but that's definitely a technique that may or may not help the drug work a little bit better. And also, if you're trying to minimize systemic absorption or any side effects associated with the drops or concerns about that, that's a great way to minimize it, because the systemic absorption happens in your nose, so you can use that technique as well for side effects. The, cost issues with drops. We send in branded medications sometimes, and it's a merry-go-round as to what your insurance may do at any given time. So as a general rule, if you get a phone call from the pharmacy saying it's $200, $300-$400, that is not what the drug is really worth. Do not pay that. Just give us a call and we'll see if we can get that lower, or if we can switch you to an alternative. But don't get worked up about it. We deal with this all the time. As far as another way to save money with eye drops, and this is actually my only conflict of interest that I would tell all my patients about, there's a product called NanoDropper, and it's a micro drop adapter for most eye drop bottles that gives you 2 to 3 times as many drops out of the bottle by giving you a smaller drop size. My colleague and I were in the process of creating a similar product, and we realized this company kind of beat us to the punch, so I'm technically an advisor to the company. But I'm passionate about the product because we've got tons of data that goes back decades that shows that smaller eye drops work just as well as the big ones, and in terms of efficacy. And there's some data that shows less side effects with some of these drops, including Rhopressa, for example, which gives you a lot of redness. There's some data showing less redness with the Rhopressa medication with one of these adapters. But the main reason I like them is that they cut the price of these expensive drugs in half by giving you at least twice as much drug out of the bottle. And for folks who are using lots of extra drops and running out of the medication by the end of the month, it's a great way to extend the life of a bottle and make it last longer, so you're not running out. And then also for samples, some samples we have to triage. I can't just give them out all the time. I rely on them to get people to surgery, and they can extend the life on the sample bottles. So that's called a NanoDropper. You can get them online. We also carry them up front at no extra cost. As far as eye drops that we use in the office, always expect to have some eye drops. We'll try to give you heads up when we dilate you. I try to tell you that the visit before when it's coming. And then chances are you're gonna get some numbing drops at least once on a visit. They sting a little bit, but we'll tell you which one is numbing and versus dilation. And but just expect to have the numbing drops that we use to check your pressure as well. Yeah, I think that's about it on general drop topics. So thank you for your time, and hope you have a great day.